Good morning. Commissioner Jim Baker here. I want to thank everybody for joining us. We have quite a gathering. There's about 70, 80 people on the call. In these situations, we will let our staff know statewide, and I believe there's several of the Department of Corrections staff members on, and I thank them for joining us, and I thank the media for taking the time and the interest to cover this conversation today. The first thing I want to do is announce that VitalCore Health Strategy as our new health provider contractor for the Vermont Department of Corrections. VitalCore took over as our medical provider on July 1st, and VitalCore has a diverse, experienced leadership staff who are positioned to help us achieve a quality of healthcare that we're looking to have. At the helm of VitalCore's leadership is Viola Regan, who we asked to join us today. Viola is the Chief Executive Officer, bringing over 32 years of correctional healthcare experience to her team and to us at the Vermont Department of Corrections. Her vision entails bringing the industry of correctional healthcare and the treatment of institutionalized persons a better quality business model, which redefines the way healthcare is provided within the correctional systems and other institutional settings. VitalCore, as I said, started on July 1st with us. I had the opportunity to visit with Viola for a length of time last week to talk about our shared interest in what healthcare should look like inside the Vermont Department of Corrections. And I was pleasantly surprised, but not surprised, that Viola brings her vision to providing healthcare to correctional institutions with the idea that there should be a standard of care provided inside correctional facilities and institutions that parallel standards of care that are in communities. And also a very heavy focus on behavioral health care. We share those values with her, and she brings a team of experts to this challenge of providing health care in the Vermont Department of Corrections that are unparalleled in the industry. And so at this time, I'd like to introduce Viola Regan and have Viola say a few words about her corporation, VitalCore Health Strategies, and her vision for healthcare services inside the Vermont Department of Corrections. Viola?
Thank you. Can you hear me?
We can hear you.
Good. Good morning, Commissioner, and thank you very much for this opportunity. I'd like to say I was very pleased to be able to work in Vermont. One of the reasons that we were so thrilled to be able to get the Vermont Department of Corrections contract is the ethics that resound in Vermont. The social discovery in Vermont that everyone deserves good quality care and that patient rights are important to you is important to us. And so we feel this is going to be an excellent partnership. We and VitalCore started this company to make sure that people knew there's another way. We're making sure that in the industry that we try to break down the walls, that we provide care internally just as you would get it externally. And how we do that is by providing the same services that you would get at your doctor's office to the patients inside the correctional facility while keeping the community safe. So we've worked very hard to make sure that happens and to be able to give us the right tools that we need to do that within our facility. And we don't come with any magic wands. It's just hard work, right tools for our clinical leaders, and bringing top of craft professionals. So we've scoured the US for those people who are actually leaders in the community of correctional healthcare, but also who have a strong clinical footprint in the community healthcare. We've partnered with university healthcare in the outside industry as well. And then we've worked very hard in making sure that we have an internal auditing process. So we bring in skilled staff. We make sure that we audit ourselves. We make sure that we have access to public services, and we can break down the walls by bringing some of those services inside our facilities. In doing that, we believe that we will be able to give our inmate population, our patients, the same level of care that you will get as when you go to see your doctor's offices. It's a new way of doing business in correctional healthcare, and we know it. We're excited about it, and we've spent the last 2 years honing this craft and making sure that it works and it's an ethical model, and we're having fantastic success with that, and we're already seeing a change. We have been here for exactly 10 days, and we're excited and getting started. Thank you, Commissioner.
Thank you, Viola. And we're looking forward to this opportunity. A couple things I want to add about the healthcare provider and the structure within corrections. First, I want to acknowledge Deputy Commissioner Judy Henkin is on the line, and the Deputy Commissioner led the team that did the request for proposal and the laborious process of selecting a new healthcare provider for corrections. And I also want to recognize Max Titus, who is part of our medical team that was part of the review of the process. And Max was very much involved in helping make the selection of VitalCore. A couple other points I want to make. As a result of our relationship with VitalCore, we are in the process of restructuring the way we support the contract internally at corrections. And that is going to be working very closely with Viola and her team, aligning the way our chain operates inside corrections, monitoring the contract. So it's in parallel with what Viola has for a structure of executing the contract and providing that level of healthcare that Viola just talked about. And as part of that, we're partnering inside AHS with the Department of Vermont Health Access, Commissioner Corey Gutherson, and we have the services of Dr. Scott Strenio from Commissioner Gutherson's shop to help us give oversight to the contract. So we now have a medical doctor providing clinical oversight and support to how we provide medical care within our system. Our healthcare system is about a $20 million a year healthcare system. It is a big piece of our budget, and it's important that we provide the absolute best healthcare to the folks that we're responsible for. We have a statutory and a moral obligation to do that. And we're looking forward to this relationship with VitalCore, and I'm very excited as a result of my conversations with Viola and looking forward to this. So we're going to hold questions to the end, and I'm going to move on to announcing the creation of the Office of Professional Standards. The Office of Professional Standards is going to replace the Office of Professional Development and Training. The change is part of a reshaped focus of the Vermont Department of Corrections on recruiting, hiring, training, constituent outreach, equity, fairness, and impartiality in our systems, our PREA obligation under the federal law, our family and friends website, and how we get back to folks that have concerns about their loved ones within the system, and a focus on data collection. We will be using data to drive the development and the formatting the areas of the Office of Professional Standards. I want to introduce today Heather Simons, a longtime employee of the Vermont Department of Corrections. She will be overseeing this team. One of the key points about the realignment of the Office of Professional Development Training to the Office of Professional Standards is Heather will be answering directly to me. And there's a reason for that. The areas that Heather is going to have oversight over and command are of absolute critical importance as we start to refocus corrections and the way corrections will look 5 years from now. So during the course of the development of this, we are engaging the advice and services of both Tabitha Moore, who is the president of the NAACP in the Rutland area, and Curtis Reed. Curtis is a longtime advocate and a tireless worker in the area of fairness, equity, and impartiality inside systems, just not inside criminal justice systems. So at this time, what I would like to do is introduce to you Heather Simon and let Heather say a few words about her new assignment as the Director of the Office of Professional Standards.
Thank you, Commissioner. I'll ask a question. Can you hear me?
Yes, we can.
Okay, and again, thank you. I'm Heather Simons, Director of Professional Standards, and also a longtime employee of the Department of Corrections. I'm approaching about 27 years working in criminal justice, and before that did pretrial service in Toronto, Ontario, so a little over 30 years. And I'm very grateful to see as many people on this call as I am, because one of the things that I think is going to inspire this work at this time of urgency is the interest of our workforce and how important it is to combine these efforts. And also in that fortunate position to know a lot of the people that work in this department, having worked with them for many, many years. Part of the vision of this office is to take the efforts that we've been making over decades and combine them in a way where we can not just follow the people that we protect and the people that we serve, but also follow our employees. And what's really a considerable commitment from this office and the commissioner and the folks that we've talked to is that when you come work here, we don't want to just recruit you, but we want to be a part of your career plan, and get a better understanding of what it actually means to live and work and be responsible for an inclusive department. That said, we know that we can't have a healthy department if we're not healthy in every area, which is why it's so important that we're creating health services that have the same commitment. We're dedicating more time, staff, and resources to the importance of training and competency, that we understand the urgency around not just competency, but how important it is that our folks are resilient and that we understand what this work means and how the impact that it has on everybody. So I think that one of the things that I think that I'm most excited about in terms of this opportunity is that we can combine efforts on conversations that many of us have been having for decades, and constituencies in terms of outreach, understanding where our community is coming from, what family members are thinking in terms of the care that we're giving, but also equally what family members of our workforce are needing to hear from us is all going to contribute to the public trust. And I'm feeling pretty hopeful, considering all that we're going to in this state and this department in this country. I don't want us to lose hope, and the hope around the stories that we've been collecting and the places that we're going to get consults have been part of how we've been putting together this plan and this vision. That said, we have a lot of work to do, and I'm very grateful for the support of the commissioner's commitment to this, as well as the commitment of our stakeholders and agency partners. I'm the vice chair of the Criminal Justice Training Council, also the first female to be vice chair of the Criminal Justice Training Council, which to me is a real commitment from law enforcement across the state that we're going to be present in our strategic thinking around inclusivity and fair and impartial services across the board. So that said, I very much appreciate this opportunity to talk to all of you. And thanks again, Commissioner.
Heather, you're welcome. A couple additional comments about the Office of Professional Standards. This is created for the purposes of, there's a framework in place, but the purpose is to grow the scope of the Office of Professional Standards. And it isn't a mistake that we chose the name Professional Standards, because professional standards is a range of ideas, thoughts, policies, and practices. And Heather has a long history in working. She sits on the Vermont State Police Fair and Impartial Committee. She has contacts with a lot of the stakeholders and experts in the state that when it comes to equity. But she made a point that I failed to make as an introduction. This is not just about how we interact with the folks that we're responsible for, either who are incarcerated or we supervise in the field. That's an important piece of what we're talking about when it comes to equity, fairness, impartiality. But we're also talking about our workforce. We want to strive. We have a diverse workforce now, especially when it comes to gender, but we want to diversify our workforce more. We want to hire folks that have backgrounds that they come from that will bring diversity in thinking to our organization. And that's going to be a big focus of what Heather's charge is inside the Office of Professional Standards. She also touched on something I want to highlight, especially COVID-19 environment. Our staff is under a lot of stress. It's been a stressful 4 or 5 months. And part of where the professional standards will touch that, and Heather touched on this, is building an organization that has resiliency. We have invested heavily in our peer support team, and we've entered into contracts with clinical support to provide clinical support for our staff during these stressful times. And Heather's been a leader in that area, and I expect that to grow as we put more policies and practices to the Office of Professional Standards. So I'm thrilled to death to announce that today. The Professional Standards has been up and operating now for a few weeks, and over the next several months, we will be engaging our stakeholders to take their advice and their direction and their guidance on how to better bring equity, fairness, and impartiality into everything we do in the Department of Corrections. I want to move on now to an area. These changes we're making are critical to the evolution of the Vermont Department of Corrections. They're aimed at improving our culture, the experiences and the outcomes of inmates, folks that we supervise in the field, but as important, as I said, the experiences and the outcomes of the staff that work for us and the folks who are victimized by crime. The communities we serve, and our role in providing public safety in the state of Vermont. I want to give an example of a case, of an incident that happened inside corrections that was, in my mind, for me personally, as the Interim Commissioner of Corrections, a big push to make these announcements today. In December of 2019, an inmate by the name of Kenneth Johnson died in the custody of the Commissioner of Corrections. DOC is conducting an internal review and a personnel review of those incidents. They've been ongoing. There are several investigations ongoing into the passing of Mr. Johnson. The Office of the Public Defender, Prisoners' Rights Office, is finishing up an investigative report. We asked the Vermont Program for Quality Healthcare to do a review. We also know that the Secretary of State's office has done an investigation looking at the licenses of the healthcare providers that were involved at the time. Disability Rights of Vermont has done a report. We've done a partial internal review, and we've asked Downs, Racklin, and Martin through the Secretary of Human Services Office, Secretary Mike Smith, to take a look at the overall picture, the overarching picture of how Mr. Johnson died in our custody. Mr. Johnson was a 60-year-old African-American male who suffered from several healthcare issues. And to respect his privacy, even after he passed, I'm not going to get into all his healthcare issues. But I will tell you this, that we know that Mr. Johnson passed as a result of an undiagnosed tumor in his airway that blocked off his airway and cost him his life. Mr. Johnson, for a period of time, while incarcerated at Northern State Facility, had complained that he could not breathe. I have not read all the reports yet, but I've been briefed. And I've been briefed enough to know that no one should die in our custody the way that Mr. Johnson passed away. The failure for our medical providers and the healthcare providers outside the facility not to have diagnosed Mr. Johnson's situation cost him his life on our watch inside corrections. Mr. Johnson repeatedly told staff that he could not breathe. I don't know why the reaction was not different, but I do know this. As the interim commissioner of corrections, I'm going to take very seriously what I've been briefed on. And that's why I'm thrilled to death that VitalCore is here now as our healthcare provider. And we've briefed VitalCore on this case as an example of how we can do better and how we must do better. Our system failed, not only our internal system, but our external system. And we should have a higher level of expectation when it comes to honoring our obligation statutorily and morally in providing the best we can for the individuals that we're responsible for, both inside our system and in the field where we supervise individuals in the community. As I said, this is an example for me as the commissioner that caught my attention. A 60-year-old African-American male died as a result of a misdiagnosis that blocked his airway and he couldn't breathe. And when telling folks he couldn't breathe, did not receive the care he should have received. That is unacceptable, and we need to do better. So I use that as an example as we talk about bringing in a new healthcare provider, but also creating a standard of professionalism that's a step above where we are now. I'm not saying that our staff is not professional. What I'm saying is every day we should wake up and ask ourselves this question: are we as good as we think we are? We should never accept that we think we are that good. We should always be looking to improve and develop systems and processes that do better. So I'm going to end the briefing now, and I'm going to open it up to questions. And Rachel, if you can manage the questions coming in, I'll try to answer those questions. If I can't, I'm going to defer them to either Viola, Heather, or Deputy Commissioner Hankin.
Right. We have quite a few of you who have RSVP'd, so I'm going to call on you in the order of those RSVPs. After that, if there's anyone on the call from the press who did not RSVP with a question and you want to ask one, we'll open it up for that as well. So first up, we have Greg from the County Courier. Please unmute yourself and ask your question. Greg, do we have you? All right, Greg, we'll come back to you. Eric from the Times-Argus.
Yes, who was the previous healthcare provider, and for this new contract, how long does it run and what's the amount?
Centurion was our prior healthcare provider, and this contract is about just shy of $20 million a year. And I believe Deputy Commissioner Hankin, 3 years, is that correct?
That is correct.
Does that answer your question, Eric?
Yes, and just so what's going to be different from what the previous healthcare provider offered to this new one? What's the change going to be?
What I think the change is going to be is Viola's outlook and her approach to the business model is much different. Very engaging, much more focused on the clinical support of the individuals in our system. You have to remember, inside our system are individuals that have serious healthcare issues. That's on the healthcare side of the equation. On the other side of the equation is behavioral health. We have individuals that suffer from mental health issues. And I believe in my conversations with Viola, and as important, the vetting of this contract was extensive under the leadership of Deputy Commissioner Henkin. And I believe that we've selected the best possible provider that will change the way we look at providing health care. And you heard Viola talk about this. It's the community standard of care. And the way we provide health care should be the same way we provide health care to the community standard out in the community. And I think that's going to be the big difference, Eric.
Thank you.
Thank you, Eric. Greg from the County Courier, are you available now? Okay, we will return to that. Alan Keyes, VT Digger.
Good morning,
Commissioner,
Alan. Good morning.
Good morning, Commissioner. Good morning. Was any action, disciplinary action taken against any people in any person in DOC regarding the death of Mr. Johnson? And if so, what was that disciplinary action?
We have not completed all the investigations yet. And again, a big piece of this was healthcare providers, the medical staff that was on duty that evening. But we're waiting for a more comprehensive overview by Downs Martin and Racklin, who the secretary has engaged to give us a better idea if in fact there was any type of conduct that should be reviewed.
Also, can you tell me if there were other companies that submitted responses to the RFP? And if so, who they are, and if Centurion submitted a proposal?
Centurion did submit a proposal, and Deputy Commissioner Henkin, are you there? Because you know this piece better than I do.
I am. There were 3 bidders for the comprehensive healthcare contract, and Centurion, VitalCore, and WellPath.
Thank you, Commissioner. Alan, does that answer your question, Alan?
Yeah. Was VitalCore the lowest bidder?
I believe they were.
They were, yes.
Thank you, Alan. If you have any follow-up questions, just can you hold on to them until the end when I open it up? That would be great. Thank you.
Thank you.
All right, next up we have Lisa from the Associated Press.
Good morning, Lisa.
Good morning. Can you hear me?
I can hear you, Lisa. Go ahead.
Okay. So is the DOC facing any legal challenges over Mr. Johnson's death?
Not at this time, we're not.
Okay. And the Centurion, how long was that contract? Was that also for a 3-year contract?
It's before my time. Deputy Commissioner Henkin, can you help me with that, please?
It was a 3-year contract with 2 one-year extensions.
Okay. So, and it basically expired is why you changed, right, to VitalCore?
Yeah, we decided to rebid the contract. You know, it's an expensive item in our budget, and we decided to rebid it. That started before I got here in January. So it was a decision to rebid it to see if we could look at the landscape to find, as I've described. I believe VitalCore is the best fit for us. and it was the perfect opportunity for us to take a look. And as it turns out, we found a healthcare provider that we think is a very good fit for the Vermont Department of Corrections, and they share our value system, which was important.
Okay. And so, I mean, you've talked about Mr. Johnson's death in relation to this. Would you say that you chose VitalCore because of that? I mean, you seem to have a strong connection to that.
I wouldn't say we chose VitalCore because of that. What I would say is that case was an example for me coming in after the fact and being briefed on it that caused me to rethink the way we should be providing healthcare inside our system.
Okay, thank you.
Thank you, Lisa.
All right. Next up on the list, we have Jen from WPTZ.
Good morning, Jen.
Jen, are you with us?
Hi, yep, sorry. Thank you so much for having us. Really quickly, just one question. When does VitalCore start taking over as far as coming within the facilities to provide healthcare? And has that, I know they said they've been here for approximately 10 days. Did that already start within the facilities, or is this something that's coming?
Yeah, so as of midnight, July 1st, they became our healthcare provider to include employing the medical staffs inside the facilities. But I will say that Viola and her team did an unbelievable job the month and a half or so leading up to July 1st, where they did an assessment of clinical skills, the staff that was in place, the structure of reporting, how clinical overview and processing went on. So they spent a great deal of time leading up to July 1st. But as of midnight, July 1st, they are in complete control and operation of our healthcare system inside corrections.
Great, thank you so much.
You're welcome. Thank you.
Next up, we have Todd from Caledonian Record.
Good morning.
No questions.
Thank you.
All right. Thanks, Todd. Okay. Colin Flanders with 7 days.
Good morning. Good morning, Colin.
Good morning, Commissioner. So could you just maybe reiterate or expand a little more on specifically what you saw in Mr. Johnson's death that you think pointed to a deficiency in the current way you provide healthcare? I think you just said his death caused you to change the way you think about the way you provide healthcare. I just was hoping you could expand that a little more.
Yeah, I'll say it again, Colin. I want you all to picture someone having an undiagnosed tumor in your airway and can't breathe, and verbalize the fact that I can't breathe. And that's how he passed away. I mean, I don't know how better I can describe what I think was a failure of the system. And look, it's just not us internally. Mr. Johnson had been transported out for checkup, for at least one checkup, where that tumor was not diagnosed within a short period of time of him passing away. And let me put it on a personal level to kind of, this is not a secret in the Vermont community that Jim Baker also has some healthcare challenges. And this goes directly to Viola's point about what happens inside the facilities when it comes to providing healthcare on a humanitarian standpoint, and a moral standpoint, and a statutory standpoint, and when it comes to privilege and what privilege brings you. This goes back to standing up the Office of Professional Standards on equity, fairness, and impartiality. Jim Baker was able to get healthcare at one of the leading healthcare facilities in the country in Sloan Kettering in New York. That saved my life. Mr. Johnson didn't get that opportunity. And that, for me, is a failure of the system. So I hope that explains it a little bit better, Colin.
Sure, thank you. And then just as far as the investigation goes, I'm assuming this is under the umbrella of the overall investigation going on, or is this a separate matter? I mean, are we expecting that this will conclude at the same time that the entire investigation or review of the system as a whole is going on?
Are you referring to the request that Secretary Smith put out for an investigation with DMR? Is that what you're referring to?
Yeah, I guess is this on a separate track, or is this all under that?
Yeah, it's on a separate track, but remember, I listed all the various entities that are taking a look at this. And I know I'm reporting this out as an example prior to all the information coming in from all the investigations. But I really don't need any more information as the Commissioner of Corrections to take action that I think needs to be taken. So we will wait for the overarching investigation to come back. This is not looking to find, this is not looking to catch someone that did something wrong. It's meant to take a look at the systems and take that information and share it with our new partner, VitalCore, so we don't repeat that kind of incident over again. That's the idea of asking for the outside overarching review of Mr. Johnson's passing.
Great. And then is there anything that Viola can say, I don't know, about how her organization would have handled this situation differently? It sounds like she's been briefed on it. Anything she can say about it?
I mean, I'll let Viola answer that.
This is Viola. I would not like to speak to that case. It is, I wasn't here during the time. I can just tell you that we, as a company, work very hard to make sure that our skills are of the highest quality that we can manage, and go by what Commissioner Baker's put in our tool house, including the Office of Professional Standards that we will be utilizing when we come up against issues that we know will may have barriers or give us linkages to the community. We're thrilled to be able to have that, but I was not here during the case, and I have nothing that I could assist you in that. We can tell you that we have great relationships that we're already developing with University of Vermont Medical Center and other community resources.
Thank you.
Colin, does that help?
Yeah, thank you very much.
Thank you, Colin. Good talking to you.
Next up, we have Courtney from Local 2244.
Good morning, Courtney. Good morning.
Hello. Good morning. Just a quick question. So, switching healthcare providers during everything that's going on in COVID, could be a good thing. I'm just wondering if there's, this might be for Viola, if there's any additional things the new healthcare provider will be doing in terms of COVID, or any kind of new protocol in terms of that.
So we actually began working in March with the Department of Corrections and shared with them our COVID plan. And we collaborated with all of the clinical team and the Department of Corrections through this process. We have a COVID call every day with the COVID team and continue that work. So there's an administrative and clinical call each day to deal with COVID. And we have a COVID plan that is developed by a highly skilled team that includes Dr. Newton Kindig and Sarah Burr, that we print every Monday for the Vermont Department of Corrections to use as a guideline.
Do you have any information in terms of testing all the inmates or staff, or does that just kind of come on a basis depending on what's happening?
Courtney, are you referring to us testing staff and inmates?
Yeah.
Well, I think you know that we are testing staff and inmates on a regular basis. In fact, today at the St. Johnsbury facility Northeast, we're testing again the entire facility to include inmates and staff. And we're testing one facility per week. So every 6 weeks, a facility is tested, even if there's no indication of cases inside the facility. And that fits in with Governor Scott's plan to test to suppress.
Perfect. Thank you.
Thank you. All right, next up, we have Ike from WCAX.
Good morning, Ike. Are you there, Ike?
Okay.
Maybe not, Rachel.
Yep. We will come back and see if Ike can join us. Emily from VPR, are you still with us? Do you have a question?
Good morning, Emily.
Okay. It looks like we are now going to open it up if any other members of the media are on this call and have a question. Please raise your hand using the Teams feature or speak up if you're on the phone.
Commissioner, it's Alan from
Yes.
Vermont Tech.
Yes, Alan.
Did the Office of Professional Regulation take any action against any healthcare provider regarding the death of Mr. Johnson?
I'm not privileged to that information. I don't completely understand their standards, Alan, but it's my understanding that any investigation they do, I don't have access to until such time as there is some type of public action against the healthcare provider.
So because you haven't received any, does that mean that there hasn't been any?
I have no idea. I have no idea. I think that would be a better question directed at them. I would suggest that be directed at the Secretary of State's office.
Okay. One last try for Greg from the County Courier. Are you with us? All right. Ike from WCAX. Emily from VPR. All right, and last call for questions. Anyone who has any, and if you've already asked one, now's your time for another follow-up. So opening the floor. Anyone have anything?
I have another one, sorry. Alan from Digger.
Go ahead, Alan.
What other entities or correctional systems does VitalCore provide services for?
I'll let Viola answer that question.
VitalCore has approximately 20 other large jail and small jail systems in the state. And we have experience, our management team has experience in overseeing and managing very large systems. For an example, Dr. Deborah Schultz, who's our president of clinical affairs, was the head of the Federal Bureau of Prisons' entire health medical care system for several years. And I was the health authority for the Kansas Department of Corrections for over 10 years. And we have extensive services in state systems for personally, and then as a company, we have large county jails.
any other contract with states for their entire system?
No, this is our first entire state system. So it should be noted that I spent many years monitoring state systems and monitoring correctional healthcare companies, and really thought it was a good experience to learn what to do and what not to do, quite frankly. As the health authority for a large state, understanding those processes was what drove me to get into the industry, to bring in a community standard of care into the correctional environment.
Alan and the other news outlets, I've asked Rachel Feldman to provide you with some materials about VitalCore. So I'm not sure how Rachel's going to make those available to you, but it's kind of an overview of the company, the bios of the leadership team, as well as a statement that they have on diversity and equity that aligns that aligns well with what we believe.
Yes, I will be sharing those with all of the press on the call in an email format after this call ends. And following that, there will be the video recording of this call for those of you who need it.
So if any more questions there, Rachel, is it time to wrap this up?
I am not seeing any other questions. 10 seconds now for anyone who may have been missed or has unmuted themselves. All right. Well, hearing none.
Yep. I want to just say again, I appreciate the media outlets getting on and your interest. We believe in corrections, that the two things we announced today are big steps forward for the department. Not the only step forward, but big steps forward. I wanted to share the Kenneth Johnson death in our facility as an example of an area, as an example of how we can improve. As I'll say it again, everyone should ask themselves every day when they wake up, are we as good as we think we are? And so I appreciate you getting on. To the corrections staff that are on the call, I appreciate you getting on and following the conversations that are happening as we move the ball forward. So if there's no other questions, I want to thank Deputy Commissioner Hankin for her time, Viola, Reagan. I think over the next 3 years in our relationship with Viola and her company, we'll be talking again to the media about the work we're doing inside the system. And I want to congratulate publicly Heather Simon for stepping up to take the office of professional standards. And I want to end this by saying on the Johnson case that as I understand, there was not a lot of direct family that were around, but I do want to offer my sincere condolences, even though it's 8 months later, to his loved ones, and I'm sorry that he passed under the conditions he did. And our commitment is that we as a department are going to not try to do better. We are going to do better when it comes to providing the $20 million healthcare system that we provide. So if there's nothing else, we'll end this press briefing, and I hope you all have a great day.
Thank you.
Thank you all.
Thank you.